in one of the most remote places on Earth, an outback mining town, hundreds of kilometres from the nearest capital city.
Couldn't imagine being anywhere else.
Broken Hill's emergency department
Saw there.
copes with the extraordinary.
Seen scorpion stings, snake bites, spider bites.
Its patients are those tough enough to call this harsh place home.
I've got a broken leg. I've got horses booked in to come over the next few weeks.
Each day brings the devastating lows.
This was my worst nightmare.
I still well up, and you just kind of swallow it and keep going.
And remarkable highs.
Thank you very much.
The most satisfying part for me is seeing someone get well and go home is wonderful. Thank you, thank you.
That can only come when you live in the middle of nowhere. As Broken Hill slowly wakes, the emergency department starts to come to life.
You can fill that in for me and just drop it up when you're done.
Exactly who will come through the doors is anyone's guess.
Hello, how are you? Good, thank you. I'll be with you shortly, okay?
Does she have any fluids?
You going to start wearing shoes?
Yeah.
I had myself a red kelpie, a small, long-haired red kelpie.
Yeah.
And I tell you what,
They were good dogs. They were
this one was a champion, mate.
excellent dogs.
I am in here because I have a sore bottom. Yes, a sore bottom. I've had the problem for about 2 weeks now. They're going to get it fixed up today, hopefully. Yeah.
Just picked up a 22-year-old guy called Peter. He's got some pain around his prostate, gloves, lube.
Well, I guess everyone's nervous about the doctor, but yeah. Well, I'm only nervous about the situation, what it's going to do, and how long it's going to take, and if it's going to hurt.
Peter, come on in. So you're not feeling yourself?
Down one side of my bum.
Yep.
Where the, I don't know what you call it, the anus hole is.
Yep.
Yeah, the right side, that's all hard and rock solid.
Been pooing?
That's the thing. I went to do it today, and it stung, and I was on the bathroom floor in pain.
Oh, no.
Yeah.
OK. Roll over, bring your strides down to below your bum. All right. Are your balls sore?
No.
Even if you touch them?
No.
OK. I'm going to need to feel inside your bum, Peter. I'm really sorry. I know that it's super uncomfortable.
Yep.
But I need to be able to make an assessment on what's happening in there to make you sore.
Do we get a safe word?
Watermelon.
Watermelon.
All right. OK. Sorry, mate. Try and relax. Breathe out. Good. Sorry. Sore there?
Yeah. Oh,
Sore there?
No.
All right.
Oh, watermelon.
I'm done.
Say it.
I'm done. Yeah, that's right. You've missed your opportunity. Peter is a great character, lots of fun, wonderful sense of humour. It's a bit of an embarrassing topic for many patients, and he deals with that beautifully.
So everything else is all good except for the problem with my...
Everything seems fine. It's just that you're very, very sore.
So I don't have cancer or anything?
I can't feel a cancer.
Oh,
You're not in a very common age group to have a cancer.
Yep.
I can't feel anything that's particularly abnormal. It's just that you're very, very sore. I can't really find anything to correlate with that. It's probably reasonable to trial a course of antibiotics to cover an infection that would be there. If there is an infection there, it's not very big. It's small, so it may well respond to antibiotics, and it will be a matter of following up and seeing how you go. Any questions?
Or you have to stick your finger up my bum again.
As often as it takes, buddy. No, I will never stick my finger up your bottom again.
The morning backlog of patients has cleared, but not everyone's in a hurry to leave.
Up at Peak Hill,
Yeah.
we had a trolley there with a blind horse in it. He couldn't hardly see.
Yeah.
And he had blue across his eye. And what we did, you get sugar, grind the sugar right up. This is fair dinkum. And you make up a funnel and you put it up there and you blow it in his eye. 2 days later, the blue was gone. And he could see. I had one eye, that's all.
Oh, yeah.
But he was bugger, he used to keep going around.
It'd be nice trying to hit blind leading the blind.
Yeah, and I used to run the horses in.
Excuse me. I gotta get going. Oh.
It's been a relatively calm start to the day, until...
He's nearly cut his ear off.
Ali, it's quite bad. We need some morphine.
2 brothers arrive in emergency after an accident with a circular saw. It's now a race against time to save one brother's mutilated hand.
How much blood you lost?
Oh, I don't think I lost that much blood. I folded my hand and wrapped it in a towel. I was just trimming up a bit of wood. A little circular saw on a thing, just trying to trim some of the wood away. I must have lost my concentration and hit my hand, and that was it. And my brother was there helping me, and I must have passed the thing to him and got him too.
I was at home and he wanted me to come and give him a hand with something. We restore old cars, we give one another a hand and that. We're usually pretty careful, but I don't know what he was thinking of when he done it, but we're very careful with tools and that. Very careful. But something when you're not thinking right, or just, you know, how things can happen so quick. And very quick too.
It looks like Paul's a little bit luckier than his brother. There's no tendon damage and it doesn't look like any bones involved, so it's all soft tissue. He's got good sensation and good movement in the finger.
How many stitches you putting in it? 35
about
or 50?
50.
Oh, I'll make it an even number.
Put in an extra couple just because he's a difficult customer.
But Keith's agonising injuries will need a lot more than stitches.
It's severe injury, it's soft tissue, losing blood. The pain itself is really a very important factor for the patient. That's why we already give morphine.
How you going, Keith?
Oh.
How's your pain, mate?
Sting.
Sting?
Sting. Now, all these factors together can contribute bad prognosis to the patient. If a part of tissue doesn't receive blood in sufficient way, it can die.
I know I've lost a finger because there's no top on it. I don't know how many more I'm going to lose. But what can you do?
The problem with your hand, it needs a reconstruction surgery with plastic surgeon to do it. And unfortunately, here in Broken Hill today, we don't have a plastic surgeon. We need to send you to Adelaide, to Flinders or Royal Adelaide Hospital by RFDS. So I'm going to organize everything to be sent as soon as possible now. I think any more delay, he would lose his hand. I think that.
I was out breaking a young horse and got on it. It was his first ride, so it was a bit spooky. Went to bucking and flipped over backwards and landed on top of me. Like the saddle landed over my leg and it rolled over the top of me.
Yep. The medicine we see out here isn't necessarily that different. I mean, a broken bone is a broken bone, but the stories behind how that bone got broken is always a lot more interesting out here.
The pressure of the horse coming down, that was what hurt the most at the time, so...
Okay.
I was a little bit dazed for a while, but I kept going still.
Before I came here, I was working in Adelaide, in Flinders Medical Centre, doing surgical training. Just for comparison. Guess what brought me out here to Broken Hill was the opportunity to get my hands dirty and get involved in real medicine.
Ow.
Is that sore where I'm touching?
Yeah,
or
just
sore?
there, that's
okay. I look after and treat most patients that come into the ED. It's a small department. Sometimes it can be a bit of a double-edged sword where there's not a lot of people around to do the many jobs that we have to do. But what gives me the biggest buzz now is I get to meet all sorts of characters. All right, I've had a look at your x-ray. Pretty good photos. There's certainly no evidence of any fracture. I guess what we do here 99% of the time is general medical treatment, but you never know what's going to come through those doors with or without warning, and how your circumstances might change with a moment's notice. No worries, thank you. Bye. Guys, male cardiac arrest coming in with CPR.
When you get a phone call that there's a gentleman who's had a cardiac arrest, you're obviously on immediate high alert. And a flush ready to go? Just give me a flush. You've got a short amount of time to set up the ED. You've got a number of priorities running through your head. You can't help but become nervous and have that adrenaline response. Someone's had what we call an out-of-hospital arrest. Their prognosis and chance of actually having a return of circulation and return to life is very, very small.
All right, let's get him on the ventilator. Can you put in a couple of big cannulas somewhere? Start compressions, please.
When you go to resus, you're just focusing on your job, your set of skills. That's all you're thinking about, you know, you're focused on that. You're there for someone in a really, really hard time in their life or at the end of their life.
All right, adrenaline, please. Yes, please, art line and a central line set up.
You know that in the back of your head, whatever interventions that you're implementing is actually trying to improve this patient, and that helps keep my emotions under control. But he's got a family, you know, you can't help but in the back of your mind be thinking about that as this is all going on.
Oh, someone's got it?
Hang on, just stop for a second, I was happy. No, he's got a pulse, he's got a pulse, yes. Good,
I have carotid pulse.
As the resuscitation's going on, for me as a more senior nurse, it's probably, and it may sound a little more callous, I feel a little bit more like it's becoming more and more hopeless.
I think we might have to start CPR again in a sec, guys. Can we get someone here ready to do chest compressions, please?
The chances are getting lower and lower and lower of us ever turning him around.
All right, continue.
Right.
12.9 blood sugar.
I think for a lot more junior staff, it's still this hope. But as a more senior nurse and the more I've seen of these, the longer you go, then you're actually getting more and more into a territory where you won't actually ever return from. I mean, it's tough, it's hard. You can't always be the hero. You can't always win, and oftentimes you don't. I mean, probably the statistics show you wouldn't.
You know, you've tried your best, but your best is just not going to fix that person, and that's what happens.
So at the end of a resus, we have a debrief. I want to actually make this a routine thing we do at the end of the shift. We just come in here, have a bit of a chat. It allows for your staff to sort of realise that everyone else is feeling the same way as you are, and you're not just out on an island. I think the outcome of the patient was going to go this way, that it did. I don't think there was anything we could have done to reverse that fact. But is there anything anyone wants to say as far as our technique and anything like that?
I mean, we got 5 minutes warning, which was nice. To be able to turn ventilators on, start drawing up adrenaline, start drawing up flushes, get lines ready, I think that's actually why that went a little bit more smoothly than it often does.
There was a couple of times where I noticed just a few members of our staff just kind of yelled a bit.
All us medical staff, doctors and nurses, deal with the death of a patient, especially a young one, in a different way. I suppose one thing that's important to remember is that we are dealing with human beings. We're not dealing with a computer or a car or some other sort of machinery. I know some people like to go out and just perhaps have a few drinks and debrief with friends at the pub. Other people just keep it all inside them. What I tend to do is I just go for a walk and clear my mind. And that could be for a few hours if need be.
Have a good afternoon. Rest easy.
Don't ever trivialise relationship you have with your loved ones, because life is so precious and you never know what's around the corner.
Yeah, thanks. See you later.
It's been a busy day for Broken Hill's ambulance officers. Now, another emergency is unfolding.
We're off to Boardman Street, which is in South Broken Hill. We're going to a 4-year-old that's fallen off a jumping castle, has hit their head and is apparently having a seizure at this present time, which is a possible brain injury.
In one shocking moment, a family barbecue has become a parent's worst nightmare.
So he just jumped from the top of the slide into the water and just fell on his backside and then started having a bit of a fit.
Do you feel dizzy? Do you feel like the room's spinning? Yeah, you do?
I only sort of caught the tail end of the seizure, and by the time I got to him, it was over. So the scariest point for me was when I said, "Can you feel your toes?" And he said no, and my heart just sunk.
What's happening? You feel funny. Do you have any pain anywhere? Does it hurt anywhere? Where? On your back. If I push it, does it hurt? It does?
Well, because he's got spinal tenderness there and he's had a bit of a fall, we're going to treat it like he's got a spinal injury. We treat spinal injuries very seriously, and there's high risk of further damage when we're extricating. We'll try for a collar, and chances are he won't like it. Most kids don't.
Hey, Ramsey, they're going to put a thing around your neck to keep your neck really still, okay?
Are you at school yet? No. Try to keep your head nice and still. Feels a bit funny, doesn't it?
It's not very comfortable.
It's going to go right around your neck. It's super brave.
Just got to stay nice and still, stay nice and calm, okay? Yeah? All right?
With Ramsey suffering a potential spinal injury, it's crucial he gets to hospital as fast as possible.
Ramsey, Jodie's going to come with you, okay?
Couple of
Jodie's
bumps.
going to sit with you and I'm going to follow up in the car, all right?
Any pain anywhere? Where?
On my back.
On your back still. Is it bad pain or a little bit of pain?
Bad pain.
Really bad?
Car restoration enthusiast Keith is at risk of losing his hand after an accident with a saw. He now needs to be airlifted to Adelaide for urgent plastic surgery.
I think any more delay, he would lose his hand and need plastic reconstruction surgery for his right hand. I called RFDS. They are organizing now for transfer. They will call me back. And I sent the picture to Flinders. Now they are looking at the picture, hopefully, and they will call me back. We need to send him as soon as possible.
Keith was up the North Mine for, well, he was up there about 40 odd years. He was a federal machinist up there. But that's what he did until the mines sort of shut down and closed up, and then he got put off. And then he works on old cars as well, the same as me, because he got me interested in them. Got to have a hobby. You just can't give up in life. But that's my philosophy anyway, so.
Okay, bed and Flinders is ready. So bed manager contacted, and what's called?
Bed manager, yeah?
Yeah, bed manager, yes. And RFDS, they're coming 10, 15 minutes.
Oh, fantastic.
Okay, all done? Excellent, thank you.
Lovely.
Thank you.
Easy. That's 30 minutes, door to door.
I'm very happy with that. We have done everything in half an hour, which is a very good thing. Thank you very much. No worries. He's gone. Yeah, excellent. Yep. So hopefully you will be there within 1.5 hours, 2 hours. Okay? And then after that, you will be on the operating theater. I wish for you all the good luck. And thanks, mate. Hopefully we have done everything in good manner for you.
I don't know if he's if the other bit of the finger's in the shed or not. Did he lose the top of it?
I guess so. I guess so.
Yeah, well, what I'll do, I'll go out and have a look at the rest for his finger.
Once you finish, you can go.
Yeah.
There's still no guarantee that Keith's hand can be saved. But thanks to Dr. Ali and the flying doctors, he at least has a chance.
So I need you to keep your head really, really still when you're coming out of here.
4-year-old Ramsey suffered a seizure after jumping from the top of a water slide.
So the seizure was how long after the head injury?
Probably about 15 seconds, 20 seconds.
15 seconds after.
No head injury.
It was not head injury.
No.
So he landed on his bum.
Yep.
And
immediately after that, he started crying.
He was like, "Mummy, mummy," just crying.
Okay.
My back sore.
Right. Was he unconscious after the fit or at the time of the fit? Because the ambulance people say he was probably unconscious for 5 seconds.
He was, yeah, his eyes were open, but he wasn't there.
Okay. Ramsey, what's the name of your mommy?
Bronte.
Wow. And daddy?
He doesn't know me, no.
It's Daddy, isn't it?
Daddy, what do I call Daddy?
Luke.
Okay.
Ramsey doesn't appear to have a head injury, so doctors turn their attention to his back.
You feel me touching here? I was concerned about the lower back because of that 1.5 meter fall. Does this hurt? Yes or no? Now?
No.
Now?
No.
Now?
Yeah.
Fearing serious spinal damage, doctors send Ramsey for urgent x-rays.
You ready, mate? We're going to take a picture now. Just want you to stay really still.
When the x-ray came back, it was reported they had some suspicion of lower spine, lumbar spine fracture L4, L5. It's on the side, it's not in the middle, but they had concerns.
Hey guys, my name's Christine, I'm one of the nurses. If you've got any questions, just holler out, all right?
Everyone obviously gets scared. It's very natural, very real concerns. You get a sick child. I've got 2 kids, so if I put myself in their shoes, I can understand.
The x-rays are inconclusive. For Mum and Dad, it's a long night by Ramsey's bedside as doctors try to uncover the extent of his injuries.
Ramsey made a miraculous recovery last night, and he was up at 3:30 this morning. Yeah, full of beans. The paediatrician said that more than likely the bone in his back isn't broken, otherwise he wouldn't be running around like he is, and also that the seizure was probably related to the pain that he went through when it happened, so they're not concerned about that. I feel very relieved that there's nothing wrong.
Three weeks ago, Keith feared he would lose his hand after a circular saw accident. After a 7-hour operation in Adelaide, he's back home in Broken Hill, and it's time for a checkup.
How are you feeling?
Oh, not bad.
Any extreme pain or anything?
No, it's pretty good now. All the stinging's gone. I still had my middle finger, and they'd put skin grafting on it, and it'd start to go a bit black in the middle. Yeah, it comes out. Surgeon said to me, he said, well, it's up to you. You make the choice. Replace the skin graft or take it off. So I said, well, level it up with the rest of them.
Looks good.
Yeah, better than what I did.
It certainly does.
Well, I'm going to try and restore some more cars. I've still got some home to do. I might run out of time though, but try. It's either that or dementia, I suppose. So which way do we go? This way. There'll be some things I can't do. I bet I can't get under the dashboards and try and do up little fiddly nuts and things, but I'll have to get over that somehow.
Next time on Outback ER, a son's anguish as doctors make a last gasp attempt to save his fading father.
Yeah, you watch your mother pass away, now you're going to watch him go the same. So.
She attempted to go to the toilet down there and she's fallen over.
Faye's unfortunate toilet break.
It looks like it's one of those kids' bike ramps, you know.
And the one-legged miner who still has a spring in his step.
Geez, I ought to get in your pants.
What's your secret?
Viagra helps.